Hi guys, so for this video this week I'm gonna go over NG tube insertion. I know this week that we've been kind of going over different lines, different drains a patient may have. So today we're going to go over how to properly insert an NG tube, okay? And of course, as always check with your hospital policy before you do any intervention, just to make sure you are aware of exactly what is required of you for your job in your specific facility, okay? So here are some supplies that you will need if you are to insert an NG tube. Of course, first and foremost, you're going to make sure that you do have a physician's order and you know exactly why the patient is getting an NG tube, and also you want to know their history. Some of the things that you want to know about the history is if maybe patient has history of any trauma. You want to make sure that there's no contraindication to inserting a tube inside their nostrils, okay? And another thing that you would want to consider is asking the patient exactly which nostril that they will feel more comfortable with having a tube. Maybe they probably have one nose, one ear that they're able to breathe a little bit better on. Of course, we don't want to occlude that nair, so you definitely want to check with them exactly which nair that they would prefer to have that tube placed, okay? So these are the supplies that you will need. Of course, you will need the actual Naso Gastric sump tube. And of course, that depends on your orders, because some patients, they may have a Dauhoff and they may have a completely different tube. But for this purpose of educating, we're going to be doing the Salem sump, the Naso Gastric tube, okay? And also, you're going to have some lube. The reason for the lubrication is just for insertion, just to make sure it gives, comfort to your patient, because putting in a tube is definitely not comfortable for them. You're also going to have tape, because you're going to, for you to secure the tube once it's placed. And also, we're going to have the actual irrigation tray. So what's inside of this tray is you're going to have your plunger and everything that you'll need, just so you can put in some output or put liquid in there so you can irrigate the tube, okay? So this is the supplies that you'll need, and of course, identifying your patient and let them know exactly what you will be doing. So, and let them know what you're going to be expecting during the procedure, okay? So, with everything that we do in the intervention, just make sure that you are washing your hands first. Let's just say I already washed my hands, and I do have my gloves. This is not a sterile procedure, and just know the abdomen is definitely not sterile, so you don't have to worry about that. Just put on some clean gloves. And the first thing that we're going to do is actually measure exactly where we're going to want the NG tube to be. This one already have a piece of tape because my students were practicing, so just pretend that's not already there. So what you're going to do is you're going to measure from the nose, behind the ears, and then you're going to go down until the side foot process, okay? And this is usually the marker for where your NG tube is going to be inserted. And one of my students, of course, already marked this, so this is why the tape is there. But having a tape there is really helpful, and just knowing exactly where you want your tube to land, okay? So now we're going to be inserting the NG tube. Just, of course, like I said, we already told the patient what we're going to be doing. Another thing that we can have there that I did not mention is if your patient is not NPO, they're able to drain. You can get like a cup of water with a straw, so they can, when you start to insert the tube, they're able to drink. That way it can help facilitate the tube to go down, okay? So we're going to be putting the tube. We're going to insert it. First, we're going to have the lube. This is a mannequin. I'm not really going to be putting lube in there, but of course we're going to put the lube. The head, of course, having the head up. If your patient is not able to support their head, you're gonna have to really secure it for them. You're gonna go down. And once it gets kind of like behind the throat area, you're gonna have them put their head down, and you can have them to swallow. Just swallow, swallow, swallow. It can be really hard to put